record today's session. Again, good morning. Thank you all for joining this provider training session, updates and revalidation, also known as re-enrollment. We do know that it's early, it's Friday, happy Friday. And first of all, we just want to say thank you for taking some time out of your morning to spend with us so that we can show you all of the exciting new changes that you guys are going to be experiencing when you start to use this new system. My name is Jerron Robinson. I am going to be your facilitator for today's session. I am not alone, though. You may see some of my cohorts in the background, one of them being Jamie Cyndia, who's also a training specialist. She may be answering some of your questions, along with Jonathan Wolf. You may see him respond to some of your questions as well. But it will just be my voice that you guys will be hearing. We do understand that some of you may be new to Zoom, and so want to take a moment to go through some of the Zoom tools so that you can familiarize yourself with how to kind of navigate it. One thing you're going to notice at the bottom left-hand corner is going to be the audio settings option, where you can actually click on that and expand it in case there's an issue with your audio. Hopefully you guys can hear me. Hopefully you aren't having any audio issues, but if for whatever reason you are, maybe you're trying to hear on your computer and it's not loud enough because you're using the computer speakers, you are able to switch to the phone, and you can either have it dial your cell phone, you can call through into the Zoom, and it would allow you to actually listen on your phone. But hopefully no one will have to do that. If you are having some technical difficulties, whether that be you can't hear, maybe you can't see my screen, feel free to let us know in the chat. Either John, Jamie, or myself will be able to respond along with hopefully helping you to, in any kind of a system issues that you might be having. What we don't want to use the chat for is for questions directly related to today's session in terms of the material, the changes, any feedback that you all might have. We do have a different section that we want to put those questions and answers, and I'll show you that here in just a moment. But if you just need to add a comment, maybe your system's not working, maybe you just want to say hi, say good morning, you're able to do so in the chat. If you're one that you just like to ask your questions out loud, we do have a raise hand feature where you can click on that, and I, Jamie, along with John, will be able to see that you've raised your hand. And then I can give you permission to speak, and you would be able to unmute yourself and ask your question, and we would all hear what you would, what you would say. Once the question's been answered, you are able to, of course, lower your hand, or I can lower your hand if you forget. But there are instances where you just don't want to type it out and you just want to ask it out loud. You are, of course, able to do that. Next, we do have the Q&A panel. So I mentioned before where we really want to, if you have a question related to today's topics, how to do something, is the system going to allow for this? I thought that it would be able to allow for this. We want you to really try to focus on putting those kinds of questions, comments, concerns, things of that nature, where we have to answer it specifically, putting that in the Q&A. The reason for it is because it would the Q&A panel allows for us to keep the question and answer kind of together. without having to split them up. When you try to do things like that in the chat, you may have some other comments in between the question and answer. And so it may prove to be a little more difficult to actually find what the answer was. This way it allows it to stay together. If you notice, you can just ask your question. In this case, how do I locate the menu? And again, either John, Jamie, or myself would be able to respond to that, and it would keep it all together without there being any kind of break in between. You are able also to toggle kind of back and forth between all of the questions that anyone may have asked and your questions by just clicking on the separate tabs that you see. Next to the Q&A is a live transcript option, which I have gone on ahead and turned on. If you are one that likes to not only be able to hear the session, or if maybe you're even having some problems hearing the session, you can turn the closed caption or the subtitles on, where everything that I'm saying will actually run across the bottom, just like it would if you were watching a show on Netflix or watching a movie and you had the subtitles turned on. If for some reason that's not your thing, you don't want that, you can just click live transcript to turn or hide those subtitles. Just to kind of go back and forth, you're able to do that. We've also got this reactions panel where when you click that drop down, you will be met with these emojis or reactions or icons. And we like to use that. For me, it helps because I can make sure that we're kind of tracking along. We're all on the same page. You're seeing what I need you to see. You're able to hear things of that nature. And then it just helps to make our time together a little more fun, a little more colorful is a word I like to use. Let's actually take a moment and practice this. Go ahead and give me any one of those reactions just to let me know. I see some thumbs up. All right, all right. A lot of thumbs up. That's awesome. Yeah, give me any one of those reactions. Great. So it looks like we're good on the reactions. If for some reason you don't have the reactions panel, it could be due in part to the way that you're logging in to the Zoom webinar today. We have found that if you're not logged in through the app, there's a hand clap. If you're not logged in through the app and maybe you're logged in through the browser, that could pose the issue where you don't have the reactions. You can still utilize that chat. There's a place there where you have reactions as well. Last but not least, we are here at least scheduled until 10:30. However, the session may not take that long. At the end of the session, when all is said and done, feel free to leave the session by simply hitting that leave button at the bottom right-hand corner. Even if it's before the end of the session and you just have to get out because you have other things that you need to tend to, that is perfectly fine. That is the way that you want to leave the Zoom session. All right, so I do want to take a moment to take a look at our agenda to go over a couple of things that we're going to be discussing today. Again, today's session is for updates and revalidations and re-enrollments for individual providers. And we are going to walk through both of those processes in great detail. I do want to give a brief disclaimer just to let you all know that unfortunately, due to some system limitations, we won't actually be able to demonstrate anything in the live P&M environment today. Don't fret, because all of the slides that you'll see in today's session are actually going to provide for you an identical, really good firsthand look at what the system actually looks like. We've gone in and created these presentation decks off of the system and what the system shows. So the screens that you see in today's session are identical to exactly how it's going to look in the real live environment. We're going to talk about how you actually go through and complete an update. So you already have an existing provider file, something has changed, could be a service address, could be some banking information, maybe you need to upload a new license. You're able to complete an update, and I'll walk you through how you do that. Again, we're unable to display anything in P&M. So what we'll go to after we look at the updates is how to access and initiate what we like to call self-service functionalities. These are things like prior authorizations, remittance advice, claim submissions, other processes as well. You will no longer be able to log in directly to MITS to perform those functions. What you will have to do going forward as of October the 1st is to log in to P&M. And then when you do need to perform one of those functions like a prior authorization, you will click a hyperlink within P&M that will redirect you to MITS to complete that prior authorization request. Now, that will be the case for the first couple of months after we go live, where you're logging into P&M and P&M will redirect you. Eventually, the MITS system will be phased out entirely, and all of those functions will not only be initiated within P&M, but they will be completed within P&M as well. And when the time comes for those processes to be completely phased out of MITS and performed and completed within P&M, we will have additional training sessions, probably starting around October, maybe November, to walk you guys through how those actions are completed when that time comes. Again, they will still be completed in MITS, just started in P&M when we go live, but there will come a time where we will offer additional training sessions because those processes will eventually be solely completed and performed within P&M. Once we've looked at those, then we're going to get into revalidations and re-enrollments. Just to reiterate what you see on the screen, revalidations and re-enrollments, they're essentially the same thing, and they occur every 3 years for credentialed providers and every 5 years for non-credentialed providers. Along with completing and going through all of those steps, we will look at what you would do once you have completed that application or that revalidation portion, and then how you actually submit that. So let's start by looking at completing an update. For those that attended a new enrollment session, this is going to serve as a recap for you. But if you did not, that's perfectly fine. This is an overview of the provider admin homepage, also known as the dashboard. So if you hear me say homepage or dashboard, this is that screen. This is the first screen that you see once you get fully logged into P&M. It is going to have all of your providers that you have assigned throughout our pre-registration process. They will all appear on your dashboard. The menu is where you're able to click on that and access some additional resources. There's a provider directory. There is a page where you can locate some important phone numbers in the contact us section, as well as some other learning resources when you click on menu. Select provider is going to give you the means to search for providers. You can move them to your Ohio ID account. You just have to get their tax ID, NPI, and Medicaid ID and plug those in there. If you're an admin, which is what this dashboard is displaying, and you have an agent that has requested access to a provider file because maybe they need to submit a claim or they need to review some correspondence, the pending agent request button is where you're able to approve that agent's access. Lastly, there's this account administration button. This is where you assign those roles. So you're able to manage what the agent can do for the provider. This is also where if maybe you've got an admin, but they're going on leave or they're leaving the company and you need to switch the provider admin role to a different individual, you would also do that in this account administration button. Even though we're not going to discuss revalidations right at this time, I do just want to direct your attention to the far right-hand corner because that is where you will see that revalidation due date. Again, we're going to look at that process a little later in this session. So you've logged into P&M because you need to perform an update to an existing provider file. What you're going to do is you're going to click on the hyperlink either under the registration ID or under provider. Because of course, you want to make sure that all of the information in that provider file stays current, it stays up to date. When you click on either one of those hyperlinks, of course, it's going to take you to the same place, and that is the Manage Application section. The Manage Application section is where you go to actually begin the update process. What you would do is you would expand the Enrollment Action Selections box and then click on Begin ODM Enrollment Profile Update. I do see that there is a question in the chat. It says in previous trainings, we were told that agents could not do enrollments and revalidations, but when speaking with Medicaid reps, they state they can. Has a definitive answer been determined? Hopefully I'm going to say what John is typing. As far as we know, and as far as the most current information is that we've received, only administrators are able to perform new enrollment application requests and submit those, updates, which is what I'm going to show you now, and revalidations and re-enrollments. We have not gotten any additional information outside of that. That functionality may be available at some point in time. We're not saying that it won't ever be available. It just currently, as it stands, won't be available when we go live on October the 1st. I also want to call attention to the box that's going to show up letting you know that you have 10 days to submit the update. If for whatever reason you have to go back to it, you weren't able to complete it in one sitting, you needed to go back to it in a couple of days, you're able to do that. But if for some reason you're not able to complete it within the 10 days, any information you've added, it's just going to be taken out and you'll have to restart the update. Now, when you click on Begin ODM Enrollment Profile Update, it's going to take you to the update screen. Now, I know that this might be a little bit difficult for you to see depending upon what you're using to access this webinar. I am going to kind of show you a smaller version of this, so it's going to look, well, a bigger version rather, so you'll be able to see it a little bit closer on the next couple of slides. But each individual category has its own update button, and you can update any one of those categories. Whether it's the most common updates, it could be identification, maybe there's a license that needs to be updated or some sort of affiliation, but you are able to update all of the sections of the application. You don't have to just complete one update in a sitting. You are able to perform multiple updates, but you can only do one at a time. So for example, if it were billing and payment address that I wanted to update along with board certification, I could complete both of those in one sitting. I would just do billing and payment address first, get it all updated, and then go back in to board certification, click that update button, and then make those necessary changes. And then you'd be able to save both of those and submit that update. So I'll show you guys how to do that here in a moment. But let's say that we were going to go ahead and update billing and payment address. I would simply click the update button, and that's going to take you into that billing and payment address section. Now, if you clicked update and it was the wrong one, all you have to do is click the return to summary button. It's going to take you back to that provider update page that we just looked at with all of those update buttons, and then you just choose the correct one. Once you're on the correct page that you need to update, you'll of course just go ahead and make those necessary changes. So maybe in this example, as it says, we've edited the contact's name, address, phone number, and email address. So we've made the necessary changes. Once everything has been updated, what you would do is you would just click save. Of course, whenever there is an address that has been updated or been changed or been submitted, you will still get that USPS database pop up. It's just letting you know that that is the database that we're going to be validating the addresses that you've entered against. You'll of course just want to hit accept. Now, when you've hit accept, in this case, of course, because it's an address, and then you've hit save again, because you always have to save again when you hit accept for the addresses, what you are going to see is that the section that you needed to update now has this red dot. So before it didn't have anything, but now it's got that red dot. That red dot is just a signal to you that the change that you made has been saved and you can proceed forward. So as long as you see that red dot, you're good to go. Of course, again, if you need to update something else, then you would just simply click return summary. And that's going to take you back to that provider update screen. When you do go back to the provider update screen, not only are you able to update everything else that you may need to, but anything that you have updated already is going to show a green check mark. Again, just another confirmation to you of sorts that this section has been updated successfully. Let's say we wanted to go back in to complete an additional update. Maybe it's the group facility and hospital affiliations, or maybe it's a required document. We would just simply click that update button. In this case, it's an affiliations update that we also want to perform. You're able to hit add new. And if you're an individual provider, you can add group or hospital affiliations to your file. Anything that's already be confirmed is going to appear in that confirmed group affiliations section. Then, of course, you can just hit add new to enter in your Medicaid. And I do believe that the NPI number pre-fills. You would hit save to add that affiliation. And the newly added group is going to appear under pending until the group provider confirms. And if there's more that need to be added, then you would just simply, again, click add new. And then once all of those affiliations have been added, you would then click save to complete the update. I do believe that I saw a couple of additional questions that have been answered, but I want to make sure that I speak to these. One question says, will the slide deck be provided? Absolutely. That's a great question. And absolutely, it is currently located in Absorb, which is the same system or platform that you guys used to sign up for today's session. You would just simply navigate to the documents and resources section, and it is there. Will there be functionalities where you can do global changes? For example, if the billing address changes for a group and all 30 providers listed under that group, will we be able to update all applicable providers at once, or will we have to do it piecemeal, one at a time? The answer or response to that is there is one admin for the group that can make changes to the group in P&M, and each provider affiliated with the group will reflect the changes made to the group. Each individual provider or their admin is responsible for updating the individual file in P&M. So hopefully that answers that question. On the update page, this is another question, on the update page, if there is info already entered, will it show up so you can see what is already there? And yes, the information will be on each application page already. Keep in mind, this is an update to something that's already existing. There's already a provider file on record that has information filled out and completed in these sections. And so that information would be there when you go to start the update. Oh yeah, I thought I saw another one. One other question. Does the group affiliation have to be requested from the individual level, or can a group do that from their side? And if the group can do it from their side, does that still require a second step for the individual to confirm? And the response to that is the affiliation can be completed either by the individual provider or the group. Only the group needs to confirm an individual provider if the individual indicates affiliation. The individual does not have to confirm the group. These are great questions, guys. Keep them coming. All right, so you've gone in and you've updated either one section, or maybe you've made multiple updates to the provider record, and now you just need to go ahead and submit it. So just want to briefly walk through what that looks like for you all. So when all of the updates are complete, what you're going to do is click this submit for review button. You're going to get a pop-up window, which is this window here, just letting you know that you've modified these following sections. It is going to list those sections there for you. Of course, you see billing and payment address, you see group, facility, and hospital affiliations, and you would just simply click OK. If for some reason you're like, well, I thought I was updating something else, maybe you thought you did something and updated it, and for whatever reason, it's not showing here. Before you hit OK, you would just want to make sure that you hit cancel. That's going to allow you to go back and return to the summary so that you can perform that update. But once you've got everything updated as you see here, then you would just simply hit OK, and you're going to get this submission confirmation page, letting you know that you have successfully submitted those updates over. Also letting you know to please allow at least 10 days for processing before attempting to submit any changes. And then you would just simply click on that return to home page button, and that takes you back to your dashboard. All right, let's see if we got, yep, we've got another question. We have encountered huge delays with adding new locations with Medicare because they cross-reference with the USPS. We have opened 2 new locations this year, but had huge delays in getting the address enrolled with Medicare, et cetera, because the USPS did not update their website or records efficiently, so it was viewed as an invalid address. This causes major delays. This actually did come up in one of our previous sessions. Sometimes this happens when it's a new address, maybe it's a new building that was just built, and so the address itself just has not been made a part of that USPS database. We have been told that unless the address is in that database, you are unable to add that address. I understand how this can be a concern and can cause those delays, and we have communicated that feedback to ODM. All right, I'm actually going to skip this because, again, I cannot show you this live demonstration in P&M. But we will talk about what happens if you maybe started an application, or you started an update, rather, not an application, but you started an update and maybe navigated away from it or had to go do something else, and you want to come back to it so that you can finish it. Of course, you would just go to your dashboard once you logged in, and then you would click on either one of these hyperlinks. What that's going to do is take you to this manage application section that we looked at a few minutes ago. You would still click on the drop down next to enrollment action selections, but instead of begin ODM enrollment profile update, it says continue ODM enrollment profile update. Because of course you've already started it and you just need to finish the update. So that is how you finish it once you start it. Now, depending upon what that update is, it may just systematically be checked through P&M, or it may have to go through some additional forms of screening. This screen here is going to, or this table here is going to show you the processes and what kind of screening or review or automated check that it has to go through, or that it will go through. It really all depends on what exactly it is that's going to be updated or changed. So some updates require additional review and some updates don't. We also wanted to, again, take a moment to walk you all through how to access and initiate what we refer to as the self-service functions. P&M is actually going to be, ultimately, it will serve as more or less a one-stop shop for you all. Whatever you've currently been doing in MITS, you just simply won't perform those functions anymore. Now, for a time, you will initiate it in PNM, and then it'll redirect you back over to MITS. And so I just want to show you where you go in PNM to initiate those functions, again, such as the prior authorizations, remittance advice. If you need to submit a claim or have an agent run a report, I just want to show you how to begin those processes. Of course, as with anything that you're having to go in and complete, once you're on your dashboard, you would just simply click on either one of those hyperlinks to go to the provider management screen. This is where you manage the applications. This is also where you can actually perform other functions, but you would do that by clicking on the drop down next to self-service selections. When you do that, this panel down here opens up, and depending upon what roles or what access levels have been granted to that agent is going to determine what they see here. If the admin didn't give them the ability to submit claims or review claims, then that claims option won't be available. Same for any one of these. It would only be what the admin granted that particular agent access to for that provider. But I do want to, since we do have all of these listed here, just briefly walk through each one of those and how and where it's going to redirect you to. So view provider file, that opens a read-only version of that provider file. Provider correspondence is going to allow you to access any correspondence that's been sent from PNM or MITS relating to the provider file. Remittance advice, when you click that, it's going to redirect you to MITS so that you can begin a remittance advice search. Same thing with the recipient eligibility. It's going to redirect you to MITS to begin an eligibility search. Claims is going to redirect you to MITS. So is prior authorization. Cost reports and rate setting redirects you to MITS so that you can access that information. Hospice is going to redirect you to MITS for those details. And then payment innovation reports, that's actually going to redirect you to the Haven portal. Now, these are the processes that will be in place when the system goes live in October. Again, like I mentioned before, there will be some system updates that are going to occur after that. And we will keep you posted on any changes in those processes, as well as offer additional trainings as we move through phase 3 into phase 4. Now, if you were part of our new enrollment presentation, we discussed the process for accessing provider correspondence, but let's take another look at how to complete that. So you would simply click on provider correspondence there. And when you do that, you're going to get this search box that comes up. You would select one of those correspondence types from the drop down and then put in a date range. Of course, as you add more and more providers and as time goes on, you may need to switch those dates just to make the search a little bit easier on you. And then once you click on that search button, you're going to get results that are going to appear at the bottom. Now, those results are going to look like this. So it's going to give you all of the items that met that search criteria that you put in, and you would simply click on the one that you need to view, and then it's going to pull up right there for you. Again, many of these self-service functions are going to redirect you to MITS. So I want you to see what that looks like. When you click on one of those that does redirect you, it's just simply going to take you to MITS. And those options are going to be seen at the top of the screen. So whether it's cost reporting, claims, eligibility, all of that you currently do in MITS, you will still do for a time. It won't be for too much longer, but it will be that way as of go live. Same thing with the payment innovation reports. Of course, that doesn't redirect you to MITS, that redirects you to the Haven portal. And then you can just click on payment innovation reports to perform that function. All right. Again, let's take a look to see what questions we have. From your experience, what department do most administrators reside in? Provider enrollment, and then grant those doing billing prior authorizations as agents, or are most administrators residing in a different department? Not really sure how to answer that. Don't know their experience. I'm sure every provider type has a different situation. Um, might make more sense for the administrator to be in an enrollment department, since being an admin gives you access to most enrollment functions. Most of the billing functions can be assigned to agents. I'm not sure if that answers your question. Um, but again, that's not sure, because we haven't ever served in that type of a capacity. But that seems to, at least in my mind, make the most sense. All right, again, guys, these are awesome questions. Please keep those coming. We will continue and talk about um, revalidations and re-enrollments and how you go about performing those. If you've been, again, if you've been in one of our new enrollment sessions, what you're going to see is going to be pretty much the same. Really, the only difference between doing a new enrollment application and then doing a revalidation or a re-enrollment is just that the new application doesn't have any information. Of course, you have to put all of that information in, and a revalidation has all of that information already there. And you just need to go through each one of those pages and make sure that that information is accurate and it hasn't changed, or if it has changed, get it updated. Again, want to reiterate that for credentialed providers, this process occurs every 3 years. For non-credentialed providers, it's going to occur every 5 years. Again, you're going to begin this process from the home page. We did talk about that revalidation due date on the far right-hand side. Now in P&M, your revalidation option is going to show up when you are within 120 days of that due date. So prior to that, you won't be able to complete it. But when you get to within that 120-day time frame, you are able to begin that process. And you would begin it in essentially the same way that you began anything from P&M, is just by simply clicking on one of those hyperlinks. It's going to, of course, take you to the Manage Application screen. You'll expand the enrollment action selections options. And then you would, of course, click on where it says Begin Revalidation. You're going to see a familiar screen. This is going to be your application. At the very top is that toolbar, allowing you to navigate by scrolling left to right. The page that you're currently on is going to be the one that's highlighted. Any pages that you've completed already are going to show with the green check. You'll also see pages that have that red asterisk letting you know that they're required. Also want to call your attention to this Jump To menu where you can click the drop down, and it is another way to kind of navigate through this application because it's going to categorically in a vertical column kind of show you all of the sections. Let's talk about the buttons that you're going to see on each one of these pages. Save is going to do exactly what it says. It's going to save that current page. Now, it's not going to move you to the next one. It's just going to keep you on that page, but it will save it. Cancel is going to clear anything that you've put in. Didn't mean to do that. Previous is going to take you back to the previous page. And next is going to be is going to save the current page. It's also going to take you to the next page. So you may be wondering, why is there a need to have a save and a next if they both save? What we found is that you'll more than likely use the save function if you need to input multiple line items of something on one page. For example, maybe you've got 3 specialties to add. Well, you wouldn't want to add one of those specialties and then hit next because it's going to save it and take you to the next page. But what you would want to do is you would want to go ahead and add one of those specialties, hit save, and then hit add new so that you can add another specialty since it's going to keep you on the same page. And then lastly, there is this generate PDF button. If at the end of this revalidation request, you want to save the application for your records in a PDF format, you're able to do so by clicking on Generate PDF, and it will save it to your computer. Now let's walk through all of these sections in the application. The first being the provider information page. Again, information will already appear here. What you want to do is to change or update it if it's not current. But if it is current, you can just simply hit next to save this information and advance to the next page. The next page is going to be primary contact information. Again, the same thing is going to apply. You're going to just double check that information that you see, make sure that it's accurate and up to date. If it's not, you'll of course just want to go ahead and change it. But once you got it all entered in, go ahead and hit next so that you can save it and proceed to the next page. In this case, it's going to be the credentialing contact page. Also, don't forget that in red, it is going to let you know whether or not that section is required. So you got a couple of ways to tell if it's a required section or not. If you need to skip it or want to skip it, since it's not required, you would just simply hit next. But you can add in that information by hitting add new, and that box is going to pop up. And then you would just put in the credentialing contacts information. Once you got it all put in, of course, then you would just you would hit next to save it, and then proceed to the next page. The next page is going to be the primary service address page. Again, you'll see all of the address information there. If it needs to be changed or if it needs to be updated, you're able to do so. This is also the page where you can add additional provider details, such as the hours of operation, whether or not they're accepting new patients. You can add their website. You can also opt out of the public-facing provider directory. Once you got all of those address details and the provider details entered, if you so choose to enter those, make sure you hit next to save it. Keep in mind on all of the address pages, when you hit next, the system does still check the USPS database. So you would want to hit accept and then hit next again to proceed. Next one is going to be the billing and payment address. Again, same thing is going to apply. You just look at the information that's listed. If it's still good, you just hit next so that you can save it and go to the next page. If it's not good, then you just change it. Once you got it all entered, again, just save it by hitting next. After billing and payment address, there's the correspondence address. Same thing is going to apply here. If the address is accurate, you just leave it as is and hit next. Again, keep in mind that on all of these pages, the USPS box is going to pop up. After the correspondence address, you do have a section for other service locations. So if you have multiple service locations outside of that primary one, you can go ahead and add all of those in this section. Again, this is not required because maybe you don't have other service locations, but if you do, you can input that information here. Of course, if you already had that information in, you'll just want to double check and make sure that it's still accurate. If not, there is the pencil and paper icon where you can go in and you're able to edit that information and make those changes. If you need to add a new service location, you would just simply click add new to add a new location. Of course, because it is a service location section, you can still add in those additional provider details, even though they're optional. You're not required to add or fill this information out, but you certainly can. And of course, that provider directory opt-out option is on this screen as well. Once you've added in all of those other service locations, you would of course click next so that you can save it. And that's going to take you to the 1099 address section. Now on each one of these pages, you may have noticed this same as practice location box. Again, you're only supposed to click that if it is the same as that primary service location. If it's not, then you just have to manually type it in. But whatever information was in there already is going to pre-fill. Again, you just need to make sure that it's accurate. Once you've verified the accuracy of it by either looking at it, making sure it's still up to date or changing it if necessary, Then you would click next to save it and go to the next page. In this case, that is the home office address section. You review it to make sure that it's still good, change it if it's not, and then of course, click next to save it. That's going to take you to the specialties page. Ooh, we're out of the addresses section. Of course, that specialty that you already had entered is going to pre-fill. If it's still good, no changes need to be made, feel free to just click next to go to the next page. Otherwise, you need to edit. You can do that by clicking on the pencil and paper. You can remove a specialty if you need to by clicking on that red X on the far right-hand side. Or if you need to add a new specialty, you would simply click Add New. Once you've got all of those specialties added in, of course, you guessed it, you would click Next to save that page and go to the next one. The next page is taxonomies. That taxonomy will have pre-filled from before. You'll of course want to make sure that that's still accurate. There are no changes. There aren't any that need to be added, or if so, you would then just make those changes or add that taxonomy. You can remove it if you need to, making sure that you add in the other one. But once you have this section filled out to your liking, you would simply click next to save it and go to the next page. In this case, that's the professional licenses page. The license that was already in there is going to show up. Of course, if it's still good and there are no changes, you would simply click next to proceed to the next page. But you may need to update it. Maybe it expired. Maybe you have a different license. You can add new by clicking on the Add New button. If it needs to be changed or edited, you can edit by clicking the pencil and paper icon. This is also, want to reiterate that for any license, a copy of each of those has to be uploaded. The way that you do that is you will see the section that says required document, professional license. You're going to click that browse button and it's going to open up to kind of search your computer for where that is located. What you would do is you would hit click on the license and then click open. And when you click open, it'll actually upload that license to the application. You'll know that it's been uploaded because you'll see it say license or say whatever it is that you saved it as, and it'll be in green. Once you've added that license and that page is to your liking, again, you would just simply hit next. That's going to save it and take you to the next page. CLIA certifications, again, it lets you know whether or not it's a required section. So if you need to skip it, you just hit next and that'll skip that section. But if you need to add that information or you need to edit a certification that's already there, you would either click Add New, and it's going to give you this box so that you can fill out the information. If you already had the information listed and it needed to be changed or updated, there would still be that pencil and paper icon. Once you've got it all added, you would, of course, click next to save and go to the next page. In this case, that's the Medicare number. The information that's in there, if it's still good, you just leave it. You just click next. If you need to add new information, like maybe you need to add a new Medicare or a Medicaid ID, you would click Add New in that section. Once you've verified that it's all accurate, up to date, you're going to hit next to save it and then go to the next page. The next page is going to be group organizations and hospital affiliations. You look at the information that's there. You change or update any information as necessary by clicking on that pencil and paper icon. If new affiliations need to be added, you would click Add New. Once you've got all of the affiliations added in this screen, you'll of course want to click Next to save it and proceed to the next page. MCP affiliations, this again is where you are able to indicate any interest that you might have with contracting in any of the MCPs in Ohio. If you had already completed or filled out this information, it will show or it will be listed. But of course, this also allows you to make changes to those indications. Maybe before you had interest in Aetna, but now you don't. So you want to uncheck it and then hit next to save it. Of course, if everything is the same, then you would just hit next, leave it as is, and move forward. The next section is going to be the state CDS number. Of course, any information that is listed, if it's good, you'll just leave it there. If it needs to be updated, then you will, of course, update it. Make sure you get it all saved up. And once it's in there, hit next so that you can save it. And then go to the next page. That next page is going to be the federal DEA registration. Of course, any information that you already put in before is going to appear. If it's still good, then you can just hit next to proceed further. But if it needs to be updated because it's, maybe expired, there's new information that needs to be added, then you would either click that pencil and paper to change anything or hit add new to add new information. Once you've got it all added, of course, make sure that you hit next to save it and then proceed to the next page. Which is professional liability insurance. Again, you'll want to just review the page, make sure it's still accurate. It hasn't expired. Everything is still good. If something has expired or maybe the information is no longer correct, then you'll simply want to edit or change that by clicking on the pencil and paper icon to update it, or by clicking on add new. Maybe it's not that the information's changed. Maybe you just have a whole new policy. So the whole thing is new. So you can add new by clicking on that button. Of course, once that information has been added, go ahead and click next so that you can save it and go to the next page. The next page is going to be education. Of course, review it to make sure that it's accurate. You are able to change and update any of that information by clicking on the pencil and paper icons, or maybe you've got some additional training. You've got some additional education that is not listed, and you want to put that information in, as you should. You'll just click Add New, go ahead and add that information on that page. And then once you've got it added, of course, click Next so that you can save it and advance to the next page. In this case, that is the malpractice claims history page. You'll go ahead and review the information on the page to determine accuracy. Maybe the answer to the question has changed. Maybe the last time that you went in and you filled or did a revalidation, maybe the answer to that question was no. But maybe things have changed. Maybe you've had an incident. So the answer now should be yes. What you do is you'll click yes. And then, of course, you'll have to click Add New to add in that malpractice claim information. Once you got it all added in, of course, you'll go ahead and click Next to save it, and then advance to the next page. In this case, that is the work history page. You'll make sure that this work history page is still accurate, because you do need a chronological work history for the past 5 years as it states. So of course, if anything's changed, you'll want to make sure that that gets updated. Or if you need to add new work details, you'll want to click the Add New button. Once you've got all of that work history information updated, again, go ahead and click Next to save it and proceed to the next page, which is the W-9 form. Again, you'll make sure that you review that page, make sure everything is accurate. There isn't anything that needs to be updated, or if there is, maybe that W-9 form is out of date, or you changed the form that you're actually uploading, or you're no longer a C corporation, you're an S corporation now. You'll of course want to make sure that you choose those options accordingly. But if there's a new document that needs to be uploaded, get rid of the one that's there by clicking Remove, and then navigating to your computer to where you need to upload the updated document. Once you've got this section complete, of course, make sure you click Next to save it and proceed to the next page. In this case, it is the EFT banking page. You may or may not have information already filled out on this page. It's going to depend on what you answered to that very first question. If you do have banking information there and it does need to be updated, again, you can simply click on the pencil and paper icons in both of these sections to get that information updated. If it's still accurate, then you would just simply click Next to save it and then proceed to the next page. The next page is going to be the required documents page. So any documents that might be required, along with any documents that might be optional, is going to be listed on this page if they are there for you, and you can upload those if you need to. Of course, if anything was already previously uploaded, you'll see it, it'll still be there. But if it needs to be changed, then you would just simply have to remove it and then upload the correct document. Once you've got all of those documents updated, Of course, you'll hit next to save it and then move to the next page of the application. We're almost done, guys. Agreements is going to essentially be the last section of the application that you're going to have to complete. There's going to be an Ohio Medicaid provider agreement. The individual that's doing the revalidation is also going to have to attest to the information that's submitted. There are several yes or no questions that will also have to be answered, along with that individual providing a digital signature. And we'll break down each section in the next couple of slides. For the Ohio Medicaid provider agreements, it's going to list each one of those. And what you'll want to do is to use the scroll bars on the right side in each section to navigate. So there's going to be a lot of information that you're going to read in this agreements section, along with a couple of check boxes that you'll have to click on, basically stating that you're acknowledging the statements and agreeing to the terms. You'll also want to read the provision check and select the checkbox if you meet that provision, which simply talks about the provider agreements, or certain provider agreements may be retroactive. Of course, if you don't meet that provision, then you'll simply want to leave that blank. There's also those yes or no questions. So you'll read through the questions. Whatever choice that you made previously will be already chosen. Of course, if you put no, then you don't have to make any additional responses or add any additional commentary. If you click yes, a comment is going to be required. So on any of those questions, if you do answer a yes, you have to provide an explanation in the box that pops up. Now it says to please make sure to provide an answer to all questions. Again, P&M won't let you bypass this screen if you forget to answer a question. Like for example, and I didn't even notice this, there is no yes or a no that has been selected on this option. We wouldn't be able to submit that because P&M is going to call your attention to it. You'll try to hit next to save it, and it'll say questions in red, letting you know, hey, there's still a question that I must not have clicked on. Once you've answered those yes or no questions, then you must attest to the information. So you'll read the attestation statement, making sure you understand what it is that you're agreeing to, and then click that checkbox. Finally, there is the provider agreement signature. What you'll do is you'll click the drop down and we'll display the name of the person that is attesting, be the individual who logged in and is completing the revalidation, that particular admin. They would choose their name from the drop down, and the provider name and user ID, that information in those fields will actually autofill. Once you've put in your digital signature, you're going to click save, and that will complete the revalidation. That won't submit it, but it will have all of the pages saved, ready to be submitted. Do see that we have several questions. I want to take a moment now and address those. My team has been working in the background to answer those for you, but I just want to call them out in front of the group. First question says, is there a place that we can look up if a provider has an FFS MCD number already, or will we still have to call to get the number? There is a column in the dashboard homepage where the Medicaid ID is shown, and it is also at the top of the screen when the user is completing the revalidation as well. Is this training the same for the group revalidation and re-enrollment that is this afternoon? If it is the same information and works the same for both, I can get some hours back in my day. This is geared towards individuals. Um, the group organization session is geared towards groups and organizations. Some of the screens that you have to complete within the application might be different, but essentially it is the same process. So if that helps you to get some hours back, Jana, then by all means, get those hours back. Looks like, okay, thanks. Register for both, as I have responsibilities in both areas, but if they are the same slides and stuff, I prefer not to do this twice. I don't blame you one bit. My voice is not the best voice to listen to. Another question says, if we are contracted with the Medicaid MCOs, are we required to add all of their service locations? Is this the section where the MCOs will collect their data for their files? The response to that is the provider should include all of their service locations. This information will be included in the public-facing provider directory. This information will then be pushed to the MCEs when reports are sent to them from P&M daily. So you would want to add in all of those service locations. Is the revalidation process the same as recredentialing, or are that two different things? I know it only has to be done in one place now, but pieces are handled by different people. So trying to determine how to assign the administrator. They are essentially the same process, depending on whether credentialing is involved or not. So if you see revalidation or see re-enrollment or see recredentialing, we're going to treat each one of those words as the same exact process. Again, the only difference is whether or not the provider is credentialed. Next question says, I see that the Medicare section is a requirement. What will our options be if a provider does not have an active Medicare enrollment? The response to that is this section may not be required for all provider types. If it is required, information regarding Medicare and/or Medicaid enrollment in other states would be included. So it would just depend on if it states on that page whether or not it's required. Whoops, I didn't mean to do that. Sorry. That was an accident. There we go. Next question says, can individuals remove a group affiliation without the group confirming? We don't unaffiliate until all claims are paid because the MCOs don't have effective dates on their side. And once the affiliation is removed, they remove that individual from our group and won't pay the claims. The response to that is I believe that individuals do have the ability to remove their affiliation without the group approving, but we will see if we can obtain further details on this process. Next question says, if we have delegated contracts with the MCOs, we would click no, right? If you already have contracts with the managed care plans, then you would not need to indicate interest unless it was with a different managed care plan that you are not currently contracted with. If we have established delegated contract, do we really have to complete all of these sections? Many of these sections would fall more under the credentialing side of the process and not the enrollment. If we are doing delegated credentialing, we should not be required to enter all of these fields, for example, claims history, affiliations, etc. Any pages in P&M that are listed as a required section will need to be completed for that particular provider. All of the pages that are displayed in this training may not be required for a particular provider or may not even display for a provider. We just wanted to cover all possible selections. Is a W-9 required for every revalidation? Right now, it's only required at initial enrollment with Ohio Medicaid. Each provider could have different flows and requirements to their revalidation. Again, if it shows as required in P&M, then it will have to be addressed. Another question says, can you click on a document that was uploaded to confirm it is the right thing before you remove it? Says, yes, thank you for asking. The user can view it to determine if they need to replace it or remove it using the red X or pencil and paper icons. There is also a download button on the document that is uploaded. And I believe if you click that, it would serve as a means of sorts for you to view it. I'm pretty sure. It would download it to your computer, but of course you could open it up to see what all was in that document before removing it. Next question says, which training will cover how to link active providers to an MCD group? Our new enrollment training module covers both affiliating a group, organization, or hospital, as well as indicating interest in contracting with an Ohio Medicaid managed care plan. Where can we access recordings of the presentations? The presentations are available on Absorb, the platform that was used to sign up for this session. The login page to Absorb can be found at, and there's the hyperlink there. Thank you, Jamie. And then you would locate it under Documents and Resources. Do we get new Medicaid IDs? The response to that is existing Medicaid IDs in MITS, excuse me, will transfer over to P&M. If a provider does not have one, then they'll have to just get a new enrollment application, and that will be done in P&M, and then that's how they're going to get that Medicaid ID. The next question says, if my revalidation is in October, when can we start on Ohio Rise site? To our knowledge, revalidations are still suspended due to the public health emergency, the pandemic. We have not been provided with a date when those resume. If you want a complete task relating to Ohio Rise, that functionality is still available in MITS today. Thank you for the information. So the future revalidation date, when available, will it be informed per email or mailed in to the providers? The response to that is yes. That date will be communicated out through a number of different channels, including Gov Delivery email and the ODM Press newsletter. These are, again, all awesome questions, guys. Hopefully, these questions, as they're being answered, that they're making sense to you all. Okay, so we went through all of the pages of the application. We've got it complete, and now we just need to submit it over for review. After you click save and all pages are complete, you're gonna get a message in a pop-up window letting you know that it has been saved. But this still gives you the opportunity to review it in case you want to just double check or triple check to make sure that everything is accurate. You're gonna still see that blue navigational toolbar. You'll see all of the sections with the green check marks. If you need to jump to a different page, you can either scroll or click that jump to drop down. Again, even in the jump to menu, you're going to see all of those green check marks indicating pages have been completed and saved. When you're ready to go ahead and submit this, you would click that Submit for Review button. If you, again, want a copy of the application to save for your records, there's this Generate PDF functionality available, and it'll just save it to your computer. But once you're ready to submit, just hit Submit for Review, and you're going to get a confirmation page that pops up. And it's just going to let you know to allow at least 10 days for processing before attempting to submit any changes. Are there any questions on how to actually submit that re-enrollment? All right, we are close to the tail end of this session, guys. Excuse me. Wait a minute, looks like we might have a question. Is there a recommended browser to use for this site? I've learned to ask, as not everything works in Chrome and not everything works in Edge, so I no longer assume all sites work right in both automatically. It's a good question, Jana. Personally, I use Chrome, and I've used it for all of the applications that I've submitted in our test environment, and I haven't run into any issues outside of just P&M issues, but no issues related to Chrome. I haven't tried to use any of the other browsers, so I don't know if they're going to give you any issues. But to my knowledge, you can use Chrome, Firefox, um, Edge. You can use any one of those, and you shouldn't have any issues. Again, I apologize. I'm unable to actually go in P&M to display, but I do want to briefly summarize everything that we have discussed so far. So initially, we talked about updates. In order to perform an update, you would, of course, log into P&M. What you're seeing on the screen now is, of course, the dashboard. And you would click on either the hyperlink under registration ID or provider. That's going to take you to the Manage Application menu, where you can open up that Enrollment Action Selections option and click to begin ODM Enrollment Profile Update. When you click on that, you're going to see the Provider Update screen with all of those different sections listed along with the update buttons. You'll choose the one that you need to update by clicking on that update button. You'll make whatever changes that need to be made, and then you'll hit save. And again, keep in mind, you know that you've saved it when you see this red dot. Of course, if you need to go back and perform additional updates, you can click Return to Summary and then click on whatever other update button that you need to go in and update. Once all updates have been made, you'll of course want to click Submit for Review to send the update request over so that it can be reviewed. We also went through the process of revalidation and re-enrollment. Again, initiating this process from your dashboard by clicking on one of those hyperlinks. You'll expand the enrollment action selections options and then click to begin the revalidation. Don't forget that this begin revalidation option won't appear until you're within 120 days of the revalidation date, which is on the right-hand side of your dashboard. Once you click to begin the revalidation, you're going to see the inside of the application. It's going to start you at the very beginning. What you'll do is you'll proceed through each of those pages, look at the information that's already there, make any changes as needed, and then hit next to save and go to the next page. You'll of course see the pages that you're on because they'll be highlighted in yellow, and then the green check mark lets you know all of the pages that have been saved and completed. Once you're done with all of those pages, excuse me, and you've verified the information that's in there is accurate or updated it if it needed to be updated, you will then hit submit for review so that you can send that revalidation or re-enrollment request over to be looked at. And again, I just want to reiterate that this process is every 3 years if you're credentialed and every 5 for a non-credentialed. Again, I want to open it up for questions. Let me take a look at the Q&A. Let's see, once we enroll in Ohio New Rise on the site, will I be automatically credentialed with all Medicaid HMOs? Unfortunately, we don't have the answer to this question. Please reach out to credentialing at medicaid.ohio.gov, and the credentialing experts who monitor that inbox should be able to provide you with an answer. Unfortunately, we just don't know a lot about the delegated stuff. Just kind of what the defined delegate admin has to do in PNM. Unfortunately, we just don't have a lot of that information. Let's see, per the earlier response that revalidation and recredentialing are essentially the same process, depending on whether credentialing is involved or not. Could you expand on that, please? If our group acts as the administrator for a rendering provider that also requires credentialing, is all of the credentialing information included in the revalidation process, or are there additional steps outside of revalidation? Currently, that is handled by 2 different people entirely for us, which may or may not be an option any longer with the change to PNM, depending on this information. Looks like John is responding to that. Let me see if our group acts as the administrator for a rendering provider that also requires credentialing. Is all of the credentialing information included in the revalidation process? I'm going to say that if it is for a credentialed provider or provider that has to go through the credentialing process, whatever those pages are going to be included in the application so that you'd be able, I don't know that you'd have to do anything outside of PNM. His response is the recredentialing of credentialed providers that would occur every 3 years would be completed in PNM by following the same steps that we covered here. Okay, so I said it correctly. Credentialed providers and non-credentialed providers would both complete that process in PNM. So it doesn't, whether you're credentialed or not, you're going to complete the revalidation or the recredentialing or the re-enrollment, whatever you want to, whatever word you want to use to label it as, you're going to complete it in PNM no matter what. Thank you, John. Thank you, Jamie, as well for all of your guys' responses to those questions in the Q&A panel. It's so great having a good team, y'all. All right. So I do want to show you guys our final slide along with walking you through how to actually evaluate the course. Firstly, just want to say thank you. Again, we started right at 8 o'clock, and you guys have been attentive from the start. So you should applaud yourselves. We certainly want to extend our gratitude for all of your questions, all of your feedback, because we can't really proceed the best way without getting that feedback from you. So continue to let us know your questions and your concerns as we all endeavor to make this as seamless a transition as possible. A couple of things that I do want to call your attention to. We would like for you to complete the course evaluation where you'll evaluate today's session. That is in the Absorb Learning Management System. I'm going to show you that here in just a moment. Also, I do want to reiterate that training materials, resources, recordings, desk reference guides, things of that nature can also all be found in that same Absorb system. Finally, beyond today's session, maybe tomorrow, maybe next week, maybe next month, you have an additional question that you want to ask, please don't hesitate to reach out to us. We do have an email that we have set up dedicated to your questions beyond the sessions that you sign up for. And that email address is on the screen. It is ohiotrainingteam@maximus.com. Let me take a moment and pull up Absorb so that I can show you where to find that evaluation. So you get all logged in. You would navigate to where that course is. Of course, mine's going to look different than yours. You would click on the view button next to that course. And then you would click evaluate. So as you can see, this is the course for today. And if I wanted to evaluate this course, I would just click on evaluate. I believe there's like 6 or 7 questions. It should only take you a couple of minutes. Can't stress enough how important it is for us that you do that, because not only does it help us to gain insight as to your concerns, things that you like, things you don't like, but it helps us to make these future sessions continue to get better and better. I'm going to go ahead and display this last slide again, and also want to again thank you all. We're all in this together. We realize how big of a change that this is for you all. We're not taking that sentiment lightly. I don't want you to think that we're being dismissive if we don't know offhand the answer to your question. We are really wanting to do our part from a training aspect to deliver this information to you so that when these systems go live, you have as many tools and resources at your disposal as possible. We understand that certain things we don't have the power of changing, but that doesn't mean that we don't submit your feedback to ODM and to our development team. We are doing that on a daily basis, I can assure you. Hopefully that helps to ease some of your concerns, but I certainly understand if it doesn't, because again, these are huge changes that you guys are having to be submissive to. That will conclude today's session. Going forward, again, please continue to use this email address, ohiotrainingteam@maximus.com, to submit your questions, your comments, your feedback, and we will respond to those in as timely a fashion as we can. You can, of course, hit the red leave button at the bottom of the Zoom screen to exit. On behalf of all of us here at Maximus, I want to wish you luck and take care. Have an amazing Friday and a great weekend.